Are you diabetic? Do you have anyone that has diabetes? Do you wish to know what happens in diabetes? That means you wish to know new things. Then this video is for you. Take time to watch. If you are yet to subscribe to this channel, do it now, because for this 1 month, I shall be spending time to discuss ways to overcome insulin resistance and as well as reversing type 2 diabetes. So if you're watching me from YouTube channel, subscribe to this channel now. Click the subscribe button. If you're watching me from other channels, maybe TikTok, Facebook, and the rest, go to the comment section of this video and get the link, subscribe to the channel, and get the full video. It is something that you should pay money to get, but I'm giving you for free because I know that this is my calling. Now, let's go straight to the problem. If, like I said in the last video, if you can resolve insulin resistance, then you have treated type 2 diabetes. Insulin resistance is one of the greatest problems in type 2 diabetes. Then today, I will not waste much of your time. Like I said, I shall be dedicating this full 1 month to talk about insulin resistance. So now let's consider one of the problems, or one of the causes of insulin resistance. The aim is to ensure that you have a normal glucose level. So there are many causes of insulin resistance, ranging from genetic factors to the rest. But today I want to consider one of them, which is inactivity. You don't exercise. You're not having enough exercise. Let's see how that affects, how that causes insulin resistance. In the morning, you eat food. If you're diabetic, you eat and go to work. Your body will produce enough energy in form of ATP for that day. The ATP is produced so that it can help you perform your task, maybe at office or anywhere. But if you are this type that after eating and the body has helped you to produce the energy currency called ATP, after eating, you sit at one place. You are inactive. Or after that, you are sleeping. What the body does is that since the body has produced enough energy for the day and you are not using them, you are not using even half or quarter of it, the body will convert the excess energy produced in and store it as fat. The excess energy the body produced so that you can use for the day to perform your task, the body will convert all of them, store them in the fat tissue, in adipose tissue as fat, and this is called lipogenesis. Now, excess fat is one of the greatest problems that leads to insulin resistance. Tomorrow, same thing. Next tomorrow, if you do this for 1 month, your body must have stored up excess fat, and this will cause insulin resistance. It will make you to be overweight, obese. Obesity is another environmental factor that predisposes someone to insulin resistance. So now, the body, having stored enough fat, can no longer respond to insulin stimulation. Remember, every tissue in the body that has insulin receptors can be resistant to insulin. But there have been about three major sites whose resistance to insulin can cause sustained increase in blood sugar. And these are the liver, fat tissues, and the skeletal muscles. In fact, skeletal muscles takes up to about 70% of glucose. 70% of glucose taken from the body to be stored elsewhere is stored in skeletal muscles. So imagine if your skeletal muscle is not responding to insulin stimulation. Where do you think the excess glucose go to? Well, some will pass the skeletal muscle to the liver for the synthesis of triglyceride. Well, I'm not considering that one today, but I'm trying to say that being physically inactive will predispose you to insulin resistance. When the body has stored excess fat, will certainly predispose you to insulin resistance. And insulin resistance, it means that the cells can no longer respond to insulin stimulation. This will cause glucose level to be so high. An excess amount of glucose level will send more signal to beta cells, telling the beta cells to release more insulin. More insulin will be produced or be released into the blood, and this is what we call hyperinsulinemia. Hyperinsulinemia is another factor causing insulin resistance. I don't want to confuse you. I want to end this video here. I'll be dedicating this whole month considering factors that could predispose one to insulin resistance and how this can be overcome, then the reversal of type 2 diabetes. Like I said, if you are yet to subscribe to this YouTube channel, do it now because more of these are coming. You should